Welcome back. Everyone at some point in their lives suffers from pain, but if that pain is severe enough, you do something about it. At the Back and Neck Institute, they are treating patients and stopping pain. Joining me is the CEO of the Back and Neck Institute, Victor Patel, the medical director, Dr. Castiel, and Johanna Pruitt, who is a patient there. Thank you all for coming in today.
Thank you for having us.
You know, I'm going to start off asking you, because we hear a lot about, back pain and neck pain and so forth. Do you think people are injuring themselves more often, or is it just more of an awareness that we have about this problem?
I think overall it's more of an awareness, just because there's so many different access points to finding out about pain between not only television and radio like they used to have, but there's so much information on the internet, and people spend so much time on the internet. So naturally people are more aware of what's going on as well.
All right, very good. Doctor, you treat Johanna here, and tell us a little bit about what brought her into your clinic and what you're doing.
Well, for a long time she's had low back pain, which has been plaguing her, which has been inhibiting her activities of daily living, and it's keeping her from having daily fun. So I've had the pleasure of meeting her, and I've been injecting her facet joints of her vertebrae that are full of arthritis. And by injecting these joints, just like you would have a knee injection or a shoulder injection, we can inject these joints under a guided fluoroscopy, live x-ray, making it very precise, very pinpoint, getting the medicine to where she needs it, and she's gotten quite a bit of benefit.
And you say you've done phenomenally well since you've been getting these shots.
Yes, especially the first month. As time goes on, and I'm only allowed to get them every 3 months, the effect wears a little bit, so I'm always very grateful to get them again.
I hear you. So, but you feel like it's giving you back a particularly a quality of life that you may not have had otherwise had you not have received these guys, the care from these guys. And I guess the one thing I want to ask you about is this particular shot, because it's something I had not heard of. What is it called again?
It's called a facet injection.
Facet injection. The facet is where the two vertebrae meet to each other, and that forms a face, or like the facet of a diamond. And where these facets touch each other, it forms a joint. It's lined with cartilage, just like a knee joint or a shoulder joint, and we're able to get medications in there like cortisone and those types of things, and something to break the pain cycle. It works very well.
Excellent. And so it's definitely worked in her case. And she was a victim of a car accident in June, but as you said, she had a pre-existing condition that dated back quite a way, so it was already there. Tell me what other kinds of types of patients you may see at your place.
We see all sorts of patients. We see patients suffering that have recently been in a car accident, suffering from back pain, joint pain, neck pain, sciatica, sports injuries, injuries on the job. Really, if you're in any kind of pain out there, give us a call. Give us a chance to find out what we can do to help you.
Well, what can you do in terms of it? I mean, do you have a medical director? Is it a full service kind of place where you have different types of things?
Absolutely. The great thing about our practice is we have a full team in place regardless of what your level of pain is. We've got a doctor in place, obviously. We've got a chiropractor, a physical therapist. We have a massage therapist on staff. So we do a little bit of everything regardless of what it is that you're looking for.
Okay. Now you guys tell us where you're currently located, and I think you're about to open up a new location, which will be easy for people to get to.
Yeah. We're currently in Orange Park, Florida, conveniently located right there on Park Avenue. And then we're also going to be opening a location pretty soon here in Jacksonville as well, right near Bay Meadows and 95, right near the intersection there. At that location, we'll be offering the same services we do now, but we'll also be offering full-fledged pain management, and we'll be offering family care, pediatrics, and we'll have a pharmacy internally as well.
Oh, that'll be very much of a convenient, I would think, for a lot of people. Let's talk a little bit about sciatica. What is sciatica? And especially when we're speaking about nerve pain and so forth, people lots of times have a hard time understanding how that all works together.
Well, sciatica is a common term that's used for a multitude of different things. But the true term sciatica is the sciatic nerve is formed from a group of nerve roots that come out of the lumbar spine or the lower back. And these roots get together and they form the biggest, thickest nerve of the body called the sciatic nerve. So anything that irritates that group of nerves or the sciatic nerve itself can manifest itself all throughout the lower extremity, gluteus area, buttocks, back of the leg, front of the leg, all the way to the foot. So anything from the actual vertebral spine to the external muscle areas where the nerve exits can be irritated, and that's what sciatica is.
Again, that's interesting to me because a lot of times you don't think how something in your lower back may actually affect your foot, but I guess it just runs down that nerve passage. Right. And you said the same thing had happened to you with your neck and in your arms.
Right. Well, I've been around a while, and life does offer you opportunities to be injured, and this current automobile accident has absolutely exacerbated everything that has happened to me over the years before. But this time it also added pain, like what he's talking about, only this time in my neck that manifested in my palms, the pads to my thumbs. And by their knowledge and their wherewithal, as I kept complaining, this is really bothering me, they thought to have an MRI done and found that indeed it involved my neck, and they were able to do cervical traction that helps, along with the other things that they do for me every time I go in.
That's fantastic. We only have about maybe less than a minute left. What would you like people to know in terms of, any final thoughts?
If a person has discomfort, if their activities of daily life are interfered with because of pain, discomfort, regardless of its cause, they should let us evaluate them, get them some answers, get them a true diagnosis, and really get a treatment plan together that will help them reduce their pain, reduce the discomfort, and just have fun in life. That's what we want them to get back to doing.
I think that's fantastic advice and critical information as well. Thank you all for being here today. Appreciate it.
Absolutely.
Thank you for having us.
Okay, you bet.